Nestled in the foothills of the Sierra Nevada mountains, Oroville Hospital has long been a trusted institution for the community it serves. However, recent events have cast a shadow over the hospital's reputation. Oroville Hospital has agreed to pay a staggering $10.25 million to settle allegations of serious wrongdoing. These accusations, centered on kickbacks and false billing, have sent shockwaves through the community and raised concerns about the integrity of our healthcare system. This settlement serves as a stark reminder that even in the most trusted institutions, financial incentives can sometimes compromise patient care. The $10.25 million settlement payment paints a clear picture of the entities impacted by Oroville Hospital's alleged actions. This significant sum is not just a number. It represents the culmination of a legal process aimed at addressing serious allegations. The lion's share of the settlement, a hefty $9.5 million, will be paid to the federal government. This payment underscores the federal government's role in regulating and overseeing healthcare practices to ensure compliance with laws and regulations. This reflects the significant role that federal healthcare programs, such as Medicare, play in funding healthcare services. These programs are essential in providing care to millions of Americans, particularly the elderly and vulnerable populations. The state of California will also receive a substantial portion of the settlement, totaling $731,000. This allocation is crucial for the state to continue its efforts in maintaining and improving its healthcare services. This highlights the state's commitment to safeguarding taxpayer dollars and ensuring the integrity of its own healthcare programs, such as Medi-Cal. By securing these funds, California aims to enhance the quality and accessibility of healthcare for its residents, ensuring that public resources are used effectively and responsibly. At the heart of the allegations against Oroville Hospital are claims of kickbacks paid to physicians. These kickbacks, it is alleged, were offered as inducements to encourage doctors to refer patients to Oroville Hospital for inpatient admissions. Such practices are not only unethical, but also illegal under the anti-kickback statute. The hospital is further accused of engaging in false billing practices, submitting claims for medically unnecessary inpatient admissions. These actions, driven by financial gain, potentially compromised patient care and wasted valuable healthcare resources. The allegations against Oroville Hospital extend beyond kickbacks and unnecessary admissions. The hospital is also accused of using incorrect diagnosis codes to inflate reimbursements from Medicare and Medi-Cal. Specifically, the hospital allegedly used codes for Systemic Inflammatory Response Syndrome, or SIRS, inappropriately. SIRS is a serious condition that can lead to organ failure and death, and billing for it commands higher reimbursement rates. By allegedly misusing this code, Oroville Hospital is accused of exploiting a critical care diagnosis for financial gain. In the wake of the settlement, Oroville Hospital has issued a statement denying any wrongdoing. The hospital's spokesperson emphasized that the decision to settle was purely strategic. The hospital maintains that the settlement was reached to avoid protracted and costly litigation, not as an admission of guilt. They believe that the legal battle would have drained valuable resources and diverted attention from patient care. They assert that they would have prevailed in a fair trial, and that their actions were always in the best interests of their patients. The hospital's legal team is confident that their case was strong, and that they had substantial evidence to support their position. However, as part of the settlement agreement, Oroville Hospital has agreed to enter into a 5-year corporate integrity agreement with the U.S. Department of Health and Human Services Office of Inspector General. This agreement is a significant step towards ensuring transparency and accountability. This agreement, a common outcome in healthcare fraud settlements, is designed to ensure that the hospital implements robust compliance measures and prevents future misconduct. The hospital will undergo regular audits and compliance training sessions to adhere to the highest standards of healthcare integrity.